Joining us are Dr. Howard Bracco and Geneva Robinson of Seven County Services. Seven County Services is the state-designated behavioral health center for our area. Seven Counties is nationally recognized for its innovative and effective programming and is fully accredited by the Joint Commission on Accreditation of Healthcare Organizations. Dr. Howard Bracco is the president and CEO of Seven County Services, and Geneva Robinson is the clinical supervisor at the Seven Counties Crisis and Information Center. So welcome to Health Matters to the both of you. Thank you for being here. Geneva, many people may experience stress or depression between Thanksgiving and the month of January. What factors contribute to this?
Well, it can be an exciting time and a fun time for many people, but along with all that excitement comes a lot of different stressors that folks are having to deal with, and those stressors are what will often cause them to have what we call the holiday blues. And some of these stressors involve expectations. And we have unrealistic expectations for ourselves at the holidays. Everybody wants to create the perfect holiday or the Norman Rockwell holiday, which isn't really attainable. So those expectations that we have can lead us to feel inadequate. And relationships also are an area that causes a lot of stress for folks. In particular, if an individual has lost somebody that they love or care about over the last year, the holidays can really bring those feelings out. When other families are together and celebrating, you really feel that sense of loss. It's even stronger when you compare that to what other people are experiencing.
It seems that sometimes during this time of the year, people don't really understand why they're feeling the way they're feeling. Everybody's happy and joyful and lights and cheering.
Exactly.
And they
feel out of sync.
Yeah.
They feel like, wow, is there something wrong with me because I'm not feeling these same things? And that's what we mean when we say unrealistic expectations. You know, realizing that the holidays can bring stress and that those are not abnormal reactions. And financial issues can also play a part in this, those expectations, especially with the over-commercialization, as you mentioned in the introduction. There's a pressure to keep up with the Joneses, to provide your kids with everything that they want. And often people feel compelled to go into debt, to do far more financially than they're able to do. And that can create a tremendous amount of stress.
And I guess in this day and age with all the electronics and the huge expense,
exactly.
that magnifies the possibilities.
Absolutely. And many people who aren't planning ahead find themselves getting into trouble in a financial sense.
Dr. Bracco, let me turn to you for a minute. What is seasonal affective disorder? And what is the relationship between these concepts?
Okay. Well, as we pointed out in terms of holiday blues, there are a variety of factors that impact the sense of sadness. In 1985, it was recognized, just from observation, that there were people who had a tendency to become depressed during the winter months. That was related to the amount of sunlight that they were exposed to. So we talk about the holiday blues or depression during this season. This is a specific reason why some people become depressed.
The change in the seasons and
the change in the seasons,
absence of sunlight and
right.
more darkness.
Exactly. The amount of sunlight that people get, change in temperature, and we can see its impact on animals when they go into hibernation. And we know that the amount of sunlight affects brain chemistry. And we don't know how it works yet, but we do know that use of exposure to sunlight, typically fairly intense light, for a period of a half hour each day, with a light that is at 25 times what a normal room light would be, has a very positive effect on seasonal depression.
Now, what about depression itself? I mean, we hear about depression, and this is an area I think many people get confused around. We hear the terms depression, depressed, sad, and now we're talking about holiday blues. What's the difference between clinical depression and this seasonal thing that we call the holiday blues?
Well, clinical depression typically goes and transcends time, so that it continues beyond typically 2 weeks. So we'll see if your holiday blues don't pass and you get back to your normal life, then there's a possibility that you're experiencing a clinical depression. that depression is looked at in terms of its intensity, its duration, how much it impairs your daily functioning, and the level of symptoms such as really a loss of an ability to experience pleasure, loss of initiative, changes in appetite, you may be eating too much or too little, hard to get out of bed, sleeping too much. When these symptoms become excessive, then we look at these as elements of clinical depression.
Can one lead to the other? If someone is currently experiencing or beginning to experience this holiday blues, can that lead to clinical depression?
There may be, in terms, an underlay of depression for some people. And what happens is when the holidays approach, the level of stress increases. And it may go ahead and exacerbate or increase those feelings of depression that are there and bring them to an identifiable level that you would say, yeah, this person is clinically depressed.
Some years ago, when I was working in a hospital, I would see a patient that every Christmas that patient was admitted with an asthmatic attack. And we began to, we wanted to keep the patient out of the hospital for the holidays, and it seemed that patient wanted to be in the hospital for the holidays because there was no one out there for her.
Sure.
Is there also an increase in suicide during this time period, during these holiday seasons?
Well, oddly enough, and Geneva can speak very well to this, there really isn't an actual increase in suicide during this period. The time that suicides seem to increase is going into the spring. And,
That's
you know,
interesting.
and that may be that, you know, during the winter months you may look at understanding reasons for feeling sad or depressed. And you look forward to those being over. And now spring has come and you're not feeling any better. And that may lead to a greater sense of hopelessness.
And a lot of times, the stress that is intensified with all that goes on during the holiday season, people don't take time to take good care of themselves. So they don't seek out help. And then the season ends and they go back into their normal lives and the stressors continue. So over time, it just worsens because they're not getting the help they need to deal with the core issues.
I mean, what's really important here, in addition to understanding this, is what do we do to prevent it? How do we bypass this, getting involved in this thing called the holiday blues? And if in fact we see someone, a family member, or see the signs in ourselves, which may be even more difficult to realize, what tips do you have for addressing this?
Well, some of the things that you can do to deal with the holiday blues, or hopefully even keep them from coming about to begin with, are to plan ahead, to realize that this might be a time of stress, and to look before you get too deep into it at ways that you can take good care of yourself. Being aware that this might be a stressful period goes a long way toward preventing some of the more extreme kinds of reactions. And it's important that people take some time at the beginning of the season to prioritize what is really important for them and for their family members in the season. You know, what really matters and what do we want to focus on. And so then you will know where your energies would be most beneficial for you. And setting realistic goals and expectations for the holiday. Again, not getting as upset if everything doesn't go perfectly, because it won't. You know, not expecting yourself to be able to meet every financial need, to be able to create that perfect Christmas. Just kind of go easy on yourself. And one way that you can do that is to continue practicing healthy habits. And quite often we get caught up in all the busyness of the holiday and we overindulge. We eat too much, we drink too much, and all of that takes a physical toll. We get busy going to parties and other activities and we don't get enough sleep or enough rest. And all those physical aspects make it a lot harder for us to handle the stressors. So being sure that you don't put your healthy habits aside just because it's the holiday is very important. And I think it's important to learn to say no, that that's okay to say no to the things that are not what you have determined that your family values most about the holiday, to only take on what you feel like you can truly handle.